is some testing that we do that serves two purposes. The testing serves the purpose of confirming our diagnosis, because remember, it's a clinical diagnosis, not an imaging diagnosis, not a questionnaire diagnosis, it's a clinical diagnosis made by a provider.
Okay.
The testing confirms that diagnosis, but more importantly, that testing guides the therapy and guides the treatment. So for example, there's a type of testing we do that looks at the eye movements. And we know that the eye movements are one of the most dramatically affected areas with the brain being injured or impaired.
Okay.
It's why a police officer, if they think that your brain's impaired from drugs or alcohol, looks at eye movements. It's a simple, easy way to do. This is a test that uses infrared cameras to measure those eye movements and then graphs them and compares them to normative data.
Okay.
One of the tests that we do that measures eye tracking gives us specific eye rehab exercises to do using an artificial intelligence algorithm so that we can help guide that patient's therapy better.
Okay.
And so that's really the testing serves kind of that dual purpose of confirming our diagnosis, but then guiding the therapy and the treatment we're doing for that patient, or that we're referring for someone else to do for that patient.
What's that eye test called?
And that particular test is called oculomotor tracking.
Okay.
And so oculomotor tracking shows what your eyes are following, and it's pretty easy to see what normal looks like and then what an injured or impaired brain looks like.